Hi, dementia caregivers. My name is Pat Snyder. I'm a dementia caregiver, educator, and I'd like to talk to you today about medication mantras. What are those things that we need to just say to ourselves over and over again? The things we need to remember all the time while we're taking care of our loved one with Lewy Body Dementia in particular. And generally with dementias, this is pretty wise advice across the board, but very, very vital advice if your loved one is suffering from Lewy Body Dementia, or if that might be a part of your story and you just don't know it, because mixed dementias are very common. So, the first med mantra that you need to make just part of your everyday life is one change at a time. Only one change at a time. That means you only add one medication or you take away one medication at a time. Very important, because if something goes wrong, if there's a bad side effect, you don't know what the culprit was if you made more than one change at a time. And so it's kind of exasperating. I know it was for me. At the beginning, I wanted everything to be fixed right away, and I had to learn to make one change, wait and really watch a few days or a week at least, and then make another change. To see if there was an improvement in John's symptoms. The other mantra is low and slow. Start low, go slow in terms of upticking or titrating up or titrating down the medication that your loved one is adding to his list of meds that he may or may not be taking. So it's very important to do only one change. It's very important to start at the lowest possible dose and then slowly add to that dosage or step down from a dosage and not make an abrupt change. This is because the brain is traumatized. The brain is undergoing a degenerative process. It's changing all the time. The environment is changing all the time. You have to make these changes very slowly. Also, if any kind of infection, disease comes into the story, you really need to stop what you're doing. Just pause, let that be treated or let that pass if it's viral, and then move forward after that's over with and things have calmed down again. It's also important to know what to avoid. What to avoid with a dementia patient, especially a Lewy body dementia patient, is just as important and sometimes might even be more important than what to take. What to take, for those of you who are new to Lewy body dementia, or you may not know this, there may be now one medication that is approved for the Parkinson's disease dementia, Lewy body disease, which is on the spectrum of Lewy body dementias. That's the dementia where the movement symptoms show up first. But dementia with Lewy bodies, Parkinson's disease dementia, clinically look the same over time. And so you basically treat them pretty much the same over time. So what to avoid for those patients is very, very important, because they have a hypersensitivity to medicine. I have an entire video on that, which I invite you to watch here on YouTube, about drugs to avoid. What to take, it's very important for you to know that this disease, Lewy body disease, is the most responsive of all the dementias to the right medications, and those are generally considered to be the cholinesterase inhibitors, and then maybe Namenda, generic name memantine, added a little bit later. There's some very good information on this. I don't know if you can see, I think the title may be backwards for you, but this is fresh off the presses from the Lewy Body Dementia Association, a brand new booklet called Facing Lewy Body Dementia Together, and it is absolutely excellent. And they talk in this booklet in very straightforward, easy to understand terms. What are you supposed to take? What are you supposed to avoid? Like I said, I spoke about this in another video, but benzodiazepines, anticholinergics, some of the surgical anesthesias, any antipsychotic medicine, certain antidepressants, and over-the-counter medicines such as Benadryl, Dramamine, and their generic names are diphenhydramine and dimenhydrinate. You need to be very careful of these medications. They can have a very negative impact on your life. And in terms of surgery, I describe that as the triple whammy. You have not only certain anesthesias that are quite not good choices for the Lewy body dementia patient, but you have the medications they take before surgery to relax, the medications they take after surgery for nausea and other symptoms. And those can also, if the choices are not wise, you have what I call the triple whammy. 3 places where the brain can be bombarded with the wrong choices. And so someone who is very knowledgeable about Lewy body dementia needs to be brought into that conversation so that the anesthesiologist and the surgeon don't make classic mistakes if Lewy body dementia is in the story at all or might be in your story. So these mantras I hope will help you. Remember, one change at a time. Start low, go slow. Be careful learning what to avoid. Be excited that there are things to take and they can have an impact even on some of these symptoms that would help you avoid some of this antipsychotic medication. The cholinesterase inhibitors, the Exelon, Aricept, Razidine, those medications actually can help with the hallucinations, with delusions, with depression, mood. They can actually be helpful with those things for some patients and quite dramatically so. So that is encouraging news. I hope you will use these mantras to help you in your journey to make it more gentle. And thank you once again for all you do all the time for your loved one, for your family, for your community. You're my heroes, guys. Hang in there. Bye.